I'm not here to tell you what to do, but I'm here to actually talk about what health style choices you can make to improve your well-being. Of all of the lifestyle choices, quit smoking is probably the most important thing you can do to improve your health, as you all are aware of. So we're going to launch into something a little bit negative to start with, but hopefully the outcomes will be good. I assume some people that have smoked, you probably often have felt like this sitting in the clinic, but it's, you know, we're here to support you to actually make that change, and that's the important thing. So it's not to fear talking about it and bringing it out onto the table about your smoking. Do you know what's in a cigarette? Are you familiar with the detail in terms of what's in a cigarette? Most people would know. To start with, there's a carbon monoxide gas that's emitted when tobacco burns. And this is poisonous, so it's important for us to realise all the knock-on effects of all the things within tobacco. And it's released, as I said, from the burning tobacco, enters the bloodstream and makes the oxygen less available in the blood. Unfortunately, carbon monoxide is a lot stronger than the oxygen, so it attaches better to the red blood cells within our vascular system. So it travels around quite happily. But unfortunately, that causes effects as well, in that it makes the blood a bit stickier. So you can end up like with vessels that are quite tightened because of that. So that in turn will lead to problems with your heart and vascular system. So it does in turn cause heart disease, and obviously that leads to problems with breathing, and all the various other organs get affected by this. Tar, which most of you possibly have heard about, like that's a 20-a-day smoker, and that's in 2 months. That's what collects in 2 months from a 20-a-day smoker. So it's quite dramatic, the amount of fluid that actually accumulates within the lung. Okay, so, and for those that have problems with coughing and wheezing, that's exacerbating that, obviously. So the tar element of it is a sticky brown substance, as I've shown you, and it collects in the lungs, and it is one of the causative factors. It's not the full cause, but it's the causative factor of lung cancer. And not alone that, there's 7,000 other chemicals found in tobacco smoke. And I've actually put the display out for that very reason, because most of these chemicals are found in other products, like in weed killer, and we have arsenic found in ant killer. We have ammonia found in your regular cleaning stuff. And to list a lot of them, acetone found in nail polish remover. So these are all found within in tobacco, okay? So it's just to make you more aware of what you're actually putting into your body. So we've acetone, which is ammonia, as I said, nail varnish remover. We've DDT, arsenic, insecticide and ant killer. And 69 of the chemicals within the tobacco are cancer causing, which is very frightening when you think of that. The big one is the nicotine, because this is the particle within tobacco that's highly addictive. And sadly, this is the one that keeps you wanting to smoke more. Because when nicotine travels into the brain, it hits those lovely dopamine receptors. And that's the one that makes us all feel good. So it gives you that satisfaction. This nicotine, every time it drops off, you want more. So that's when you have the withdrawal symptom, I need more. So you keep wanting more, because that feel-good factor is when the dopamine, and that's your happy hormone, for those who don't know the name. It's the happy hormone. It's the one that makes us feel good. So that's why we like to keep it in our system. So it's a powerful drug, and it only takes 10 to 20 seconds by inhaling. It's a very quick entry, so if you're breathing it in, it travels very quickly to the brain, making it more addictive even than cannabis and all the stronger drugs. As I said, it quickly becomes addictive, causes heart disease and blood pressure problems. So we'll move on to the short-term effects. So the less oxygen to the brain, which is fairly obvious, the cough, the chest infections and shortness of breath, reduced energy and concentration, and understandable because your oxygen levels are going to be depleted. They say that's between 15 to 20% depleted in somebody that smokes, as against a normal person that can breathe normally, okay? Gum disease, bad breath, stained fingers, smell, less money, less control is a big factor in all of this in trying to give up, because it is about taking back that control. Because you're the victim, and that's the problem. It's the tobacco that's the problem, not you, okay? So we have to think of it from that point of view. The long-term effects then, and these are hard facts, and I'm sorry I have to present them, but that's what I'm here for. 1 in every 2 smokers will die from tobacco-related diseases. 19% die on average every year in Ireland. 30% of those are circulatory deaths and 25% respiratory. Smoking is a major cause of lung cancer. Smoking also causes, however, reduced vision, peptic ulcers, vascular disease, lowered immune system. And for those who are attending the hospital for any form of operations, post-op effect would be that if you continue to smoke, it takes longer for the wound to heal. So the tips for success, it is all about preparation. It's the most important thing before you launch into any lifestyle change. You really have to take stock of, this is not my friend. It's like if a dog bit you, you wouldn't go near him again. This is eating at you all the time. So it's something you really have to hit home, that you are the victim of this, and this is the problem, not you, okay? So you have to switch it around and perceive it that way. And set your date and stick to it. Yes, seek support in the hospital, your friends, your colleagues, anybody, your partners, whatever, they will be your support. And it is important to get them on board, because this is not an easy choice to make. Change your routine, plan ahead. That's the biggie, because when you associate a cigarette with the first thing after your breakfast, plan something alternative. Watch for the triggers, they're the big ones. Save money, think positive, that's the important thing. And a big one in this, take some form of physical exercise. And that can be just walking a short distance even. And watch the diet, because a lot of people come back to us and say, well, I'm putting on loads of weight and that's affecting my blood pressure as well. So it is important to plan what's in your larders or in your homes when you do make such a big choice and change. And take one day at a time. No different to the alcoholic, no different to the guy that eats too many buns or cakes. It's the same thing. We're all planning, it's all plans, and it has to be actioned. Yes, there are many cravings, and I appreciate that, but it's hard if you don't know about them. You have to think about them and work with them. Irritability is a huge factor in all of this, because you're losing that nicotine out of your system, guys. So it's important that you think about how you might deal with that. And it is about maybe taking up something new in your life to get rid of that tension. And likewise, there are other coping mechanisms for all of this. The cravings will only last for 3 to 5 minutes. In 5 minutes, you could change your whole perspective on the whole thing. So to delay the first, if you have given up, to delay that time, walk around, maybe do something, cook, brush your teeth, do something that'll actually distract you. So distract yourself, as I said. Deep breathe. I will be following this talk with a little bit about a well-being program that we do run, and it's all about learning how to deep breathe properly and use it in lifestyle changes as a stress management technique, because you will get quite stressed with this change, because the nicotine is gone, the dopamine isn't being released. All right? So it's important to think of strategies to actually achieve that. But have something for the hand-to-mouth action. Have something in your hand. There are other methods, and we can stand over these ones because they're well-researched methods, and they do prove that it doubles your chances of success. If it is that you're somebody that is so addicted that you feel you won't cope in doing cold turkey, as it's called, giving it up just blanket, there are other methods. Not alone the service that we provide and the support that we give, but nicotine replacement therapy has been proven to double chances. The products contain 1/3 of the nicotine from that of the cigarette, approximately. The cravings from nicotine withdrawal can be very difficult, so the replacement helps because it weans you off. And as I said, there's quite a few products that we might go into a little bit more detail in a moment. No tar, there's no carbon monoxide or the other chemicals that we've mentioned. And as I said, it can double your chances in success. It's free on the medical card, and always get advice on how to use it properly. Got your gums, your patches, your inhaler, which looks like a little cigarette holder, guys. So for those who are very fond of having the cigarette in their hand and has become such a habit, this is a good little gadget in the sense that you have something there. And I remember my own dad used to carry it around here for a year almost when he gave up. So if it is that it's a habit in terms of holding on to something and hand to mouth, this is a really good gadget. Within this, there's the cartridges that go inside it that contain the nicotine. The Champex, it's a tablet that is non-nicotine. It's prescription only, it's available in a medical card. And this is for more hardened smokers who would be well over 20 a day, and they find it really difficult. But as you remember, I've mentioned the whole dopamine release. This actually helps in that, one, it's non-nicotine, but what it does is it blocks the receptors and allows the nicotine not to be attached to the receptors, and it blocks the nicotine completely. But also it gives a little bit of dopamine release, not as high as the actual nicotine itself, but it gives that little feel-good factor. So it keeps you maintained along the pattern of giving up. And most of these products are a 3-month cycle. So the important thing is to stick to the cycle of doing that. Partially blocks the effects of nicotine on the brain, relieves the craving and withdrawal symptoms, and reduces enjoyment of the cigarette, which is a big factor. Because most people in the room who are smokers, if there are any, say, I love my cigarette, it's my best friend. But it is important to start turning that on its head and try and think of methods to actually change that and get rid of this habit and addiction. Again, can double your chances. You start the first week actually smoking with the tablet, which a lot of people like. Day 1 to 3, then you take 5 milligrams per day, and then 4 to 7, 5 milligrams twice a day. And you maintain the 1 milligram for up to 12 weeks. But likewise, with all the other products that I mentioned, the Nicorette, these are for 3 months as well, guys, okay? So it's important that you continue the course, because some people get very brave and think, oh, sure, I'm doing fine now, and they stop. But it's important to see it through. Some of the side effects, again, of Champex can cause mood changes, but also you have to remember the products, all medical products will cause some form of side effects. There's no question about that. But in terms of giving up cigarettes, sometimes it can be alluded that giving up the cigarette has the same side effects as the actual side effects of the medication, whether it be nicotine or the Champex. So it's just to remember that. So don't give up on it if you think, oh, sure, this is causing this, this, and this. You have to give it time, all right, in terms of success. So on the positive note, after quitting, you'll all realise that there are changes going on once you quit. And it's important to realise that even within 20 minutes, heart rate, blood pressure return to normal, which is vital for you looking for the light at the end of the tunnel here, okay? Because it is important. In 48 hours, the carbon monoxide leaves your system, providing more oxygen for the body. So that's 2 days. Isn't that wonderful? And we can actually measure that with a little machine to tell you, and it motivates even more, because you come into the clinic, you get your measurement, and you see there's no carbon monoxide being measured, which is super for people that are giving up, because you see, well, I'm doing something good here, because there's no carbon monoxide taking the place of my oxygen, because you've right to breathe properly, and you're getting rid of all that carbon monoxide, okay? So it's important to think in those ways, all the positives about this. 3 days, airways relax, making breathing easier. Sense of taste and smell. That's a big one, because sense of taste for everybody, you might have lost it for years if you're a smoker. And then suddenly, oh, that yogurt tastes off. In fact, you know, that's what happens. So you realise you weren't actually tasting the food that you were eating. So it's a lovely thing to realise, and you can enjoy your food so much more. Smell improves. In 2 to 12 weeks then, our circulation improves, so much easier to walk from A to B, from here to the shop. Energy levels increase and bones get stronger. Skin damage is stopped and hair is healthier. After 3 months then, the lung function increases by 5 to 10%. And that's a huge factor in the respiratory conditions that you're dealing with. So cough, wheeze, shortness of breath improve. Sorry, and after 1 year there, the risk of heart attack is the half of that of a smoker. So you've made all these changes, and in 1 year it makes a dramatic change on your whole health and well-being. You smell fresher, so you feel fitter, more energy, relief from the guilt. And that is a big one, because most of us are on a path now where we might be a bit unwell and we feel guilty. What did I do wrong? It's not you that's the problem, it's the product. So we have to start blaming the product. And despising the product will make the motivation even stronger. That thing has done it to me, as opposed to you doing it to yourself. So change the whole thought process in it, and it brings on the motivation to get rid of it and to take back the control. Bringing back that control in your life, saying no to something that's actually doing so much damage. And obviously you're going to have more money, so this is another factor in it. Put it into a big jar and save it, and maybe a holiday or a massage or something to treat yourself, because you've succeeded in a massive lifestyle change. Every attempt to quit smoking is worthwhile, and it's never too late, and that's what makes the difference. I'm going to move on now just to a second program that backs this up. This program is actually a stress management well-being program. So it takes smoking, but not alone smoking, a lot of other lifestyle changes, and it motivates people to make change. Because with a lot of change, we get quite stressed about it. Will I succeed? What if I fail? You even start thinking about that before you start. And this program is only a 6-hour taster program for a lot of people. Some may have done various programs in the past that have helped them stress manage or manage their well-being or health. It runs in the hospital monthly. It's over 2 days. We separate the 3 hours one week and 3 hours the next, because people go off and do a bit of homework. Well, it's not real homework. It's actually quite a lot of nice relaxation. So it's learn to manage your stress in life and relax. That's what it's called. So it's provided free of charge, and as I said, it runs in the morning times and generally 2 consecutive days in 2 weeks. It covers a variety of lifestyle skills, and this would be the wheel that we would base the program on. As you can see there, we talk about breathing in 60 seconds. Now, when I say exercises, this is just stretching, because we hold on a lot of tension in our back and our muscles from stress that is built up over the day. And the breathing is the big one. Breathing is our life. Breathing is our gift. Relaxation techniques will be introduced. We'll talk a bit about physical activity, certainly about your diet and nutrition. The posture and muscle stress. With the stretches, this relieves the tension and helps you to make changes in that respect. Certainly from a group point of view, there's huge social support in this. Time management, all about the thought process and how it works. And for even giving up the smoking, the thought process is a vital thing, because our thoughts create sometimes most of our worries. And most of those thoughts aren't true. So I would have to say you're not responsible for the first thought, which is the fear of not being able to succeed, but you're certainly responsible for the second thought and the behaviour with it. So if you think about it, knock out the first thought, the fear, and work with the action bit and trying to make a change. All right? And we would support you through the programme with that. A little bit of communication, obviously, emotional skills, a lot about humour and play. It's really important, the old laughter. It's a real tonic. It releases all the nice feel-good hormones and really does help in terms of making lifestyle change a lot easier. And certainly spiritual values, albeit personal, it is involved. We would chat about that a little bit as well. Thank you.